Hi one and all, this is Dr. Vasavi working as a consultant periodontist in KIMS Dental Kondapur branch. Today I will be discussing regarding the how to tighten the loose teeth or decrease the mobility of the tooth. The main discussion of topic is. So first I'll coming to the what is mobility of the tooth. According to Miller's classification, the tooth mobility was classified into four types. Grade 0, no mobility of the tooth, grade 1, grade 2 and grade 3. Coming to the grade 1, the horizontal mobility less than 1 mm, grade 2 is horizontal mobility greater than 2 mm, grade 3 is horizontal mobility greater than 1 mm and also associated with vertical movement or compressibility of the tooth into the alveolar socket. Coming to what are the causes of the tooth mobility, the main problem with the tooth mobility is mainly it may associated with trauma to the anterior tooth or the back tooth, and TF4, trauma from occlusion or the pregnancy related changes or hormonal influence on the person during pregnancy or inappropriate orthodontic treatment, or the main problem I can say gingivitis, which may lead into periodontitis, in which the alveolar bone loss can be seen, is also associated with the mobility of the tooth. These are the five foremost reasons which may cause the mobility of the tooth into the oral cavity. Coming to the treatment approaches to decrease the mobility. First, we need to identify the cause of the mobility. According to the cause, the treatment modalities or the options will differ from patient to patient. If it is in coming to the first reason, trauma from occlusion, we need to evaluate the grade of the mobility. If it is grade 1 or grade 2, the treatment approaches are root canal treatment followed by splinting by using a wire and composite or the permanent crowns. If it is grade 4, if only the leftover option for the patient will be removal of the tooth. So we need to assess the cause, followed by assessing the mobility of the tooth and the treatment approach which are related to that. Coming to trauma from occlusion. Trauma from occlusion can be relieved by doing enameloplasty, relieving from the upper tooth or the lower tooth, whatever causing TF4, we need to relieve it. If it is not doing with that, then we need to align the tooth by using crowns or with the orthodontic treatment, aligning the tooth into the normal position, relieving the malocclusion and providing relief from the trauma from occlusion and decreasing the mobility of the tooth. Coming to the third one, pregnancy related changes or hormonal influences. Once a female is into the pregnancy, there can be increase in the hormonal changes. Mainly the progesterone levels will increase, in turn may increase the gingivitis incidence, may also cause sometimes mobility. Eventually, when the female and the 9 months are done, as the hormonal influences are decreased, the patient may revert back to normal, or we can do scaling or the oral profile axis to decrease that. And sometimes it may some people may require temporary splinting using wire and or composite splinting. Coming to periodontitis, in which again the grading we need to assess, followed by the approaches. If it is grade 1, simple wire and composite or fiber splint may helpful. If it is associated with grade 2, in cases may also require, the tooth may also require root canal treatment to decrease the mobility of the tooth, followed by the permanent crowns, which may act as a permanent slinting for the particular individual. These are the different modalities. And sometimes if it is in the initial phase, for suppose in gingivitis, if it is into moderate inflammation, only the gum with crustal bone loss, in that cases, complete disinfection of the mouth, that is oral profile axis, and disinfection of the false pockets or the true pockets if present, followed by this antibacterial therapies using mouthwashes in the topical form may also be helpful for the patient. These are the different approaches and causes which are enlisted above, and we need to assess them and provide the appropriate treatment to decrease the mobility of the tooth.